Well, the government shutdown has stretched into its 8th day and will continue into tomorrow. Senators failed for the 6th time to pass a spending deal since the shutdown started. Frustrations growing on Capitol Hill. At first, Democrats were holding out over extending health care subsidies. Now the threat of not paying furloughed workers is creating extra issues. Party leaders continue to talk past each other through interviews on TV and press conferences. Both sides accuse each other of not wanting to negotiate in good faith.
Well, the IRS says it's furloughing nearly half its staff due to the government shutdown. Agency says it furloughed more than 34,000 employees today. The IRS says it will temporarily pause many taxpayer services such as answering phone calls and halt most administrative functions, and that Americans can now expect longer wait times, delays and changes to tax code and backlogs. However, IRS functions that are required to keep the Social Security Administration open will continue.
Military families across the country also feeling the pinch of the shutdown.
Yeah, the Defense Health Agency announcing Tricare may not be able to pay for service claims after October 1st. Fox SA's Destiny Fuller has been all over this story. She's live on the Northeast side tonight with details.
Ryan, Ashley, practice owners who accept Tricare say that this government shutdown has them in a turnstile. As the money gets tighter, local doctors are doing what they can, and they're trying to stay afloat. Doctors and practices that accept the military benefit Tricare say their practices are at the mercy of the government as the government shutdown stretches into day 9. Tricare announcing payments could be on hold.
I think that this is going to have far-reaching effects because it potentially is affecting families all across the United States. That's millions of families. It's not only active duty, but it's retirees. It's anybody who receives Tricare benefits.
Dr. Britt Sims is the Executive Director of Integrated Behavior Solutions, practice geared towards serving families of children with developmental disorders. Practice was struggling before the shutdown because of backlogged payments from TriWest.
We've spent the year exhausting every option just to stay open, and now those options are gone.
Dr. Sims says he's missing out on roughly $200,000 dating back to January 1st. When we spoke to him in April, he said he took out around $180,000 in loans to stay afloat. Now he's making cutbacks, telling employees today they'll be furloughed starting Monday.
We can last a couple of weeks on what I have personally, but I've now. I'm done. I'm spent. If by some miracle something happens, then I don't know. We'll keep fighting somehow.
Because of all of this, everything is completely stalled and halted, and we have a lot of families that need services, and we just don't have the capacity to be able to do that because we're not getting paid.
Dr. Giacchini also owns a small practice, the Blossom Center for Children, which serves autistic children. But with $500,000 in loans to pay back, things are getting tight.
We don't even know if we're able to continue to take Tricare and to be able to sustain our practices using our Tricare as a funding source.
Even just a pause of a few days, that means that there may be a backlog resulting in weeks of getting these payments out to providers.
They're all asking the community to look at the bigger picture.
Families are losing critical services, and employees, Americans that have a heart for this are going to be out of a job.
We reached out to the DHA to learn what this shutdown means for businesses that are already struggling, but they didn't have anyone available to talk to us. We did reach out to TriWest, who says that they are committed to going back to normal as soon as the shutdown ends. Live from the Northeast side, I'm Destiny Fuller, Fox SA.
Tonight, Fox SA is first to report on how the shutdown is impacting Texas hospitals, including right here at home. It's forcing some essential services to be put on hold. One of those is the Hospital at Home program, which allows certain patients still recovering to receive hospital-level care in their own homes. The Texas Hospital Association tells us around 27 hospitals in the state use the program, and without it, they would have to discharge patients or move them back into the hospital for care. While it's unclear how many have been impacted, we're told University Health in San Antonio was one of the earliest adopters of the program, and it's been a valuable resource for the community. Another concern for THA is what will happen with the enhanced tax credits set to expire at the end of the year.
Equally important, and we expect that the health insurance companies that are wanting to join the marketplace to be a part of the option for patients and using those tax credits. They're certainly making decisions right now about whether or not they're going to let a plan go live or not. And so, we worry that this is, as much time goes on further, we're compounding problems.
THA also tells us telehealth flexibility is allowed for Texas hospitals through Medicare. They have also been put on hold until the shutdown is resolved.
Children have superheroes and adults can